that I think most of you are not familiar with just because we've never taught you how to use Athena. So we're formally going to do that today. Romeo's coming in to help, and then obviously it is open forum, so ask questions, even if he's at a point to where you have something that you've encountered before that you are confused about, or that you know something more than we do, because we're still learning it as well. So again, it's bipartisan here. And I will let Romeo take over.
All right. So let me back up for a second. So all of you bring your laptops in, and let me check in this patient. This is going to be my test patient. So when you're at the clinic and you want to know who's next or anybody like that, take back. This is how we get to know. We can see you will be ready for staff. So once you take it back, you can click on it.
There's simple things that I didn't know, so just going up there gets you to your dashboard.
So there's two ways. There's Athena net over there, and over here where it says test. Either one will get you to the same thing.
Those are the simple things, because I'm like, if I have a screen that I don't identify with, I'm like, how do I get where I need to be?
Easiest way when you check somebody in and get your vitals, just go right ahead and go to your intake, right up there. From here you can type whatever the visit is for, so it will be on the top of the notes. So, abdominal pain, whatever they're here for. If it's not in there, you can just click on the notes right here and add your notes. If your vitals, height, weight, temperature, medications, and your allergies, which are the most important things that we need to know.
So go in and put a couple of medications in, because there's details. You guys, do you have any questions as far as putting the details of how they're taking it as well, making sure that all that's accurate? Everybody's got that down? Okay. That's fine.
There's aspirin, so if the patient has been taking it for a while, you can just go to the calendar and add whenever they've been taking it. Just click add. We'll add them up. Now this is different than ordering a prescription.
Right.
So
How would you add a drug if it's not on the drop-down list? I had a patient that was that way. I don't know if it was the dosage or the actual drug combination itself, but it wasn't an option to click.
do you remember what medicine it was?
Can't remember. It's been like 2 weeks ago.
Okay. If it happens, let me know, and I'll be able to add medications
Okay.
to it if I need to. So, the whole history and everything is on the left side that you can get into for the patient. Social history, family history. A lot of them are not going to tell you about shots.
So usually when I'm researching a patient, when I very first get into a chart, I will go and figure out how to get you the whole rundown as well. Like their visits they've had will be over here.
Down here on your left side, look at visits, click on it, it will tell you when the last visit was. You can click on the line on the very top. If there's any labs, anything that I have scanned in from ultrasounds, MRIs, or anything, they're all going to be there, including cardiology visits. Issue vitals, whatever history they have had. Look under results right there. That's the other place you can find your X-rays, MRIs, CTs, and lab results.
There was something else there. So in social history and that, if you need to add to it, you can click on those blue arrows as well. And it'll pop it up over there where you can add any notes to it as well. Whenever you guys are documenting, are you able to see where it says HPI Review Systems at the top of your screen, so you're seeing what we're seeing? That was the only thing that I was concerned with, to see if you guys as students were able to visualize what I'm seeing.
For that one, you just go to the exam, and it will pop it up.
There you go. So the first thing that you need to do when you're starting documenting as well is go up to here and change this to make sure it's the faculty member that you're working with, so you'll click on that, and then start typing in our provider. That way, it automatically goes into our queue. If you have ordered any labs or any referrals, it'll go to that faculty member. There's also going to be, how do we know whenever it gets over?
I don't think
Professor Reggie, I can't, I'm looking at one of my patients right now and it's blacked out. I can't click on it even. It's under
Have you
Professor
already seen
Robic
the
Plaza.
patient?
I've seen him.
Okay, you can't change it after you've seen it.
Oh, okay.
Yeah, once you've seen them and it's been signed
Locked.
off,
Yeah.
then it can't be changed, it can't be altered.
Can I change it on the next visit or is it like
You
first
have
time
to
they
do
go
an
in?
addendum.
Oh, do you guys want us to do that if it's locked in under somebody?
It should never be locked if you're just now starting with the patient.
Well, I saw him like 2 weeks ago and I'm following up.
Oh, okay, so then it'll be a whole new encounter.
And I can change it then at the new encounter? Okay.
Yeah, once it's signed off, it's signed off.
So it's just like any other document, you can't go back and change it once it's signed off. You have to do an addendum. So anytime you read a report and that, if you're adding like an interpretation, it would be an addendum or a note added to that. So as a provider, you can, as you see this over here, those diagnoses and orders here, if you clicked on there, doesn't work, there you go, on the plus sign, then you can put in whatever it is that you're wanting to diagnose. And like I said, if you can't, if it doesn't come up with something that you're wanting specifically, Google ICD-10 data, and then that gives you a tool on your phone to be able to search for a specific diagnosis that you're looking for. But you'll see as it pops up, yeah, like gastroesophageal reflux disease, do hypertension. So it's also there at the top of your A&P. So see where it says assessment and plan at the very top, and then it says diagnoses and orders? If you click on that plus sign up there, you can add your diagnoses as well. And when you're putting in a diagnosis like hypertension, it'll pop down below and give you a choice of whether this is essential hypertension, primary, secondary, and then once you click on a diagnosis, it'll also give you a choice of a workup, whether you want to do an initial workup because it's the first time you've diagnosed it, or if you're doing a follow-up workup, and it'll kind of give you clues of what those workup suggestions are. So it kind of helps guide you as well through that. Were you guys familiar with that technique of utilizing? So.
Also, when you're out here on your AP, you see it in red, your ICD-10, like on a little plus sign. That means there is a subcategory to whatever diagnosis you're looking for. So if you're looking at diabetes, you're gonna see all the other ones that you have to pick from.
Red means it's non-billable, and so they would not be able to collect for that encounter, so you have to go more precise because it's too broad of a diagnosis. So make sure that once you do finish your diagnoses that it's green. If it's red, click on it like he said and see if you can narrow it down even further to be more precise. Diabetes is going to ask you whether there's complications, whether there's other secondary comorbidities, all of those kinds of things, because that makes it more complicated. It also goes into effect when your insurance companies are trying to reimburse you of that level of service that you're giving them, because you've had to also consider all of these other things, all these other medications, all these other disease states that go along with it, or these complications that are going along with their diabetes.
Also, you won't be able to sign off on your chart without clicking that red. So over here where it says signed off,
You guys can.
It's not gonna be green, so. Review the systems. Physical exams.
So when you're doing your physical exam as well, you go up to that plus, and it'll give you choices of templates. So you can narrow it to what type of template. So like if you're just doing a brief pelvic exam, or an overall annual physical exam of a female to where it's their whole body, not just the pelvic, it makes that template according to what you're doing. And it'll help teach you as far as a focused physical exam according to what their chief complaint is as well. So this EMR is actually pretty neat because it's also teaching you what's appropriate for that chief complaint or that certain problem base that's being presented by the patient. Yes.
So we go through all of the tabs on top besides sign off. Is that correct?
Correct.
Yes.
Okay.
Yes.
So we're responsible for everything else other than that.
Yeah, you cannot sign off. Just make sure that at the end of your A&P, your assessment and plan, that you are putting your name as a student on PAS1. That way we know who it is that's following up on it as well. And by signing your name, lets us as faculty know that you're done with it, and we won't sign off on it if your name's not there. Yeah.
Where in that A&P section do you want us to put that? That's
Just at the end of your, when you're typing.
but it's like kind of like you,
In sections.
yeah. So
Just the last section is fine. Obviously, under assessment plan, it's got your diagnoses there, so it's not gonna give you a choice to type underneath that.
yeah, that's I guess
But
why.
under like your patient instructions, the very last thing that you're typing in,
Uh-huh.
then put your
Okay.
name. Anything that you're free entering data
At the very.
and not clickety. The other thing is that I know that some people like to type your data instead of clicking those boxes for like review systems and that. The problem with that is an EMR is gathering points to each click, and they're able again to determine your level of service and level of charge off of what you've been clicking. And if you've just free typed it all in there, then the EMR is not going to be able to decide what level of service you offer.
How much time do you actually spend with your patient and your pay for that?
And so when you go and work for someone else or another facility, then your medical records department, your billing coding department are gonna come back and go, look, I know you typed all this in here, but now you gotta click what you typed, because it's not going to allow us to charge for that.
Because they're not gonna read it all and figure out what they're going to diagnose as. Too dumb. I don't know.
Yeah, because it's a lot of work.
Yeah.
And that's why we wanna type it in, because it's faster, especially when we've got pre-made templates. Takes forever to clickety click, but it'll be per the protocol of wherever you're working as well. So, however you guys do it like that. Any other big questions? Is there any other big sets? As far as like your lab orders and that, that's also under A&P. So do an example of a lab order for hypertension.
Lab.
Put in hypertension and it'll choose. There you go. So there's follow-up versus an initial, so do initial. And then it'll give you choices of all these labs down below. It didn't. Order this. Oh, because you already put it. So when you put an order in, it'll also cue the faculty member that they have to sign off on those orders. I know you guys are filling those out at Good Shepherd on paper, but by putting it in here as well, flags us to be watching for that result. Because we're watching it on the computer and we don't have access to the paper back at the facility. Okay. Referrals as well, so you can literally type in referral in there for like OBGYN or
to our pharmacy, next door.
So this is where you would put your prescriptions in versus tapping on the medication box over the side.
It's gonna ask you for a diagnosis for Tylenol, so.
Same way, if you typed up for an order for a CBC and you didn't have any diagnoses yet, it's gonna cue you to put in a diagnosis, because you have to have a diagnosis ICD-10 for everything that you order. So it'll work both ways, whichever way you wanna start with.
It just depending what EMR you're using, just make sure you actually have a pharmacy down there.
Is there any trouble areas that anybody's having a problem navigating through the system on? You guys are pretty much getting it down now. So anytime you see a patient, whoever your faculty member that's working with you, that's who you're emailing, communicating back and forth on when your note's done and being ready for review, as well as being signed off once you've made those corrections. Dr. Vanetta is still learning as well, so just make sure that you're communicating with him, and if he's not responding, he's got other obligations at other facilities and other educational bases as well, so don't hesitate to contact one of the other faculty members that were present if you have a lack of communication on that.
Also, for anything we do in office, glucose tests, hemoglobin A1Cs, you have to put them where your A&P are here. Under point of care.
Point of care. I didn't even know that.
Yeah.
And so where do you put those results in?
Right there. Let me show you. So you just click back on it. Where we collected. And here's your results. And it's still gonna ask you for a diagnosis because we ran something with diabetes. But pregnancy tests, dipsticks, hemoglobin A1Cs, glucose, x-rays that we do in the office, they all have to be out here. Yeah, 'cause I need it there.